and this is heart and great vessels. Great. So the only thing I have to remember with this is is my arteries, and don't forget to do a JVD. Otherwise, it's a real classic. Inspect, palpate, percuss, and auscultate, and it doesn't take very long to do the heart, which is really nice. So for the heart, the only thing I'm really going to need is going to need my stethoscope and my measures for JVD.
Am I laying down?
Yeah, you know, that actually would be okay. Either way, it doesn't matter. Yeah. As a matter of fact, why don't you just sit on the side of the bed? I'll tell you what, let me put it up a little bit so you're not so far down on the ground. This is ergonomics, right? So what I've done is I've washed my hands, right? I'm introducing myself, doing 2 patient identifiers. I'm going to provide for privacy, explain what I'm going to do. I'm going to actually clean my instruments, and I want to thank you for allowing me to do a heart assessment. So the first thing I'm going to do, oh, I did forget something with the head. What was it?
Thyroid? I'm not quite sure.
Oh yeah, I did that when I did like that.
See?
What did I miss on the head and neck?
Altered. The ALOC.
Oh, the cranial nerves.
The tapping? No,
You know, you already put
I didn't ask her any questions about her head.
Oh.
Oh, we always do subjective data first, right? Don't forget the questions first with every single thing. I just realized that. So what would I have asked about the head? What do you guys think? Headaches.
Medication.
Medications.
Surgeries in the head.
Surgeries. Diseases. Seizure, stroke. Head injury, trauma. Yeah, there you go. Oh my gosh. Wow. So I didn't get 100% of that one, did I? So don't forget. Don't forget your questions. What's that?
Like how much, what percent would that be?
You know what? It just depends on how many are there, and it would just be one of that. So what it would be like? I don't know, not even a tenth. It'd probably be like 7 of 100 are off, or so like if I get 93 or something. I don't know. It's really funny because if you look at these, I don't know if anybody has. Does anybody have the? Oh, here it is, right here. Okay. So let's just say here. Okay. This is how we usually figure it here. It just depends on how many steps are here. So for head and neck, what did you have to do? Let's see here. Oops, this person's missing. Oh, there it is right here. For head and neck, it was 1 thing, 2 thing, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25. It's about 25 things, so I missed 1 thing out of 25. Okay, but subjective. Always remember to ask questions first. Thank God, I just remembered that. It just dawned on me. I'm getting tired, folks. Sorry, but all right. So let's go now with heart, right? So the first thing I'm gonna ask is chest pain, right? Pain for PMSD, right? Chest pain?
No.
Do you have any medications that you take for your heart?
No.
Any kind of water pills or pills for swelling?
No.
And have you ever had any surgery on your heart, like a cath procedure or CABG, like a coronary artery bypass graft?
No.
Do you have any diseases like hypertension, high blood pressure?
No.
Angina with chest pain with exertion?
No.
Ever take nitroglycerin for chest pain? Ever have that ordered for you?
No.
Let's see, what else can I ask? Have you had any problems with stroke?
No.
Do you have any problems with cholesterol? Have you ever had labs where your cholesterol was high?
Had labs, but everything is fine.
Great. Do you have any diabetes?
No.
Do you have to sleep with a lot of pillows under your head?
No.
Do you have a frequent cough?
No.
So those are all like cardiac kind of questions, right? Okay. You don't have to ask as many as that, but you can. But ask 4 or 5. I think 3, 4, 5, something like that. I think will be good for a start for this exam. So the first thing I'm going to do is inspect. Remember that in the hospital we would be looking at skin, right? And also our stethoscope would always be against skin, never on people's clothing. But we're just doing that here for demonstration. So I'm going to look at the precordial area of the heart here, the precordium, and I'm looking for heaves to see if there's any heaves. I see a carotid artery there, but I don't see any heaves on her chest, right? So the next thing I'll do is I'm going to palpate the precordium, aortic, pulmonic, Erb's point, tricuspid, mitral valve here. Make sure that there's not any heaves of the chest, and there's not any thrills, which might indicate regurgitation of blood. Now I'm going to palpate. And so to palpate, though, for our testing purposes, we're only going to palpate the upper borders of the chest. So what happens is, here's her sternal notch. Running my finger down, that's her second rib right here. So her heart should be here and here. So I'm going to palpate. I should hear hollow sounds, hollow sounds, hollow sounds. Then I'll hit the heart, and that'll make sort of like a dull sound. There'll be a change in the sound. Definitely a real flat note over bone, and then I'm going to have like a dull sound here, and then she should not have heart here. It should be clear again. So let's give that a try. Tell me if I'm hurting it. Now she get a change. Hear the change? It was this. Now this. There's a little bit of change there. So that's her heart. Oops, sorry. That's bone. That's very dull. The heart again. And then it should be a very hollow sound here. Hear how it's hollow there? Okay. So I know her heart is right about here and here. I'm not going to do the lower portion of the heart to see if it's in the 6th intercostal space to see if the heart's enlarged. But I know that the top borders of her heart are in the proper place. So I've inspected, I've palpated, I've percussed, and now I'm going to auscultate. And I'm going to auscultate two ways. I'm going to auscultate first with the diaphragm, and then I'm going to do the bell. But when I listen to the mitral valve, she'll have to lay on her left side. Okay, so I put on my stethoscope, and I'm going to tap to make sure I'm on the right side. There we go. Okay. So 2nd intercostal space, I'm going to go aortic pulmonic. So aortic. Your heart's beating fast. Real fast. Pulmonic. I have the stethoscope down as the Erb's point. That's the 3rd intercostal space. That's where we're going to hear aortic and pulmonic to close together the best. So can you take a deep breath? Just want to see if I can hear a split S2. Okay. And then right on the sternal border here at the 4th intercostal space, that's the tricuspid valve. I hear that very clearly closing. And then I have mitral here at the 5th intercostal space, mid-clavicular line. And now I'm going to turn this over, do the same thing to see if I hear any murmurs in the heart. Aortic. Pulmonic. I can hear those close at a little bit different time. Isn't that cute? The split S2, that's amazing. Okay, so for this one, you have to lay on the left side. Yeah, so if you can lay on the left side, that would be good. Remember that for the mitral, a lot of people do have a problem with like incompetent valve, especially the mitral valve is often replaced by surgery, mitral valve replacement. So what I'm going to do is, if you lay people on the left side, it really gets that heart to the front of the chest. And so I'm going to turn really right on side like that. Okay. And then I'm going to put this on 5th intercostal space, and that way I can detect a murmur or regurgitation. All right? Okay.
Did you hear one?
Yeah. Huh?
Did you hear one?
Do you have a murmur? Yeah, let me listen real carefully because I'm just going as fast as I can here. Listen
It's
real.
an S1, so.
Yeah, I do. It goes shoo, 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 shoo. I can hear it. Is it like what, like grade 3 or something? Did they say
No,
or grade
grade
2?
1.
Oh, it's a grade 1. It's a very subtle, very subtle. I can hear if you really listen, you can hear shoo, shoo, shoo. But it's real short. It's a real short, like But your heart's beating a little faster too.
I'm anemic also, so that's why my heart beats so fast. You didn't ask me that.
You know what? I thought your conjunctiva looked a little pale. Yep, there you go. Oh, but I didn't want to say it. Oh, isn't that funny? Oh my God. Oh my God. Look at that. That's amazing. Oh my gosh. Her heart's beating faster because she's anemic. I could feel it too in her. Remember when I told her she has blood pressure problems and her heart's beating fast? I could feel it in her carotid, her temporal artery there. So now what I want to do is the JVD, okay? So I want you to lay down here with no pillow, okay? And then we're going to see if she has any right side heart failure, see if she has any jugular venous distension. I'll make sure my bed's at 30 degrees, and this one's exactly at 30 degrees. So what I'm going to do is I'm going to take 2 rulers, and I'm going to have her turn her head to the side here. I'm going to look for her jugular vein. I definitely see I can really see the pulsation of her carotid. Her heart's really beating fast. I mean, it's beating fast, a little bit hard. Yeah, you see there? But what I'm looking for is the jugular vein. Oh, right there. That's the jugular vein there. You can almost see it's almost like a little bit of a blue color. And I'm looking for the pulsation of blood. There's no pulse there if you put your finger on it. But I'm looking for the pulsation of blood. I'm going to say right about there. So what I'm going to do is that I'm going to make sure that I have centimeters here. Like the 1, 2, 3 here. I'm going to go down to her 2nd intercostal, the sternal notch right here. And then I'm going to measure that straight across perpendicular. It's hard to tell because your carotid is really beaten there. So what's your H and H? She's about a 1.5. So she's less than 3 at 30 degrees. So that shows that she doesn't have jugular venous distension and probably not in congestive heart failure or right side heart failure. And the thing is, we're not going to do the jugular hepatic reflux. The only thing I have left though to do that I can't forget on here, I can't forget the jugular veins and the arteries. So on this, I also do the arteries where I'll palpate the arteries, and then palpate, and I'll also auscultate them too when I do the heart. Okay, and so that should be everything. Did I miss anything?
Auscultate and record apical pulse.
Oh, what did it say about the apical pulse on there?
It says auscultate and record apical pulse. That's it.
Oh, so maybe when we're listening with that diaphragm, we shouldn't forget that. So we'll go aortic, pulmonic, Erb's point, tricuspid, midclavicular line, and hold it there and count for 1 minute the apical pulse, right? Or 30 minutes if it's a regular pulse. You'll count for 30 minutes. My God, 30 seconds. That's the rule now. It used to be we had to do it a whole minute, but now they say if you have a regular heartbeat, you can listen for 30 seconds times 2. We'll give you the heart rate or the apical pulse. Great. So I'm glad you said it. I haven't looked at that for like 6 months. So very good. So I'm going to count the apical pulse and see if it's a proper rate. I know what a rhythm is. It's a regular rhythm, but I can guarantee you if I really did count her rate, it would be a little tacky. I bet. Not. It'd be the high end normal probably.
Yeah, high normal.
Yeah, high end normal, and yeah, her heart's beating right along. So what's your H&H?
Well, my H&H 6 months ago was 9.2. But I
Really?
just had it done last week and it was 11.1.
Oh, thank God. Yeah, so that sounds a little bit better. Yeah.
I had
Yeah.
gastric surgery 10, 11 years ago.
Uh-huh.
And
Do you get gastric bleeds?
no.
No.
But I've been on supplements ever since. Like,
Is it like a malabsorption problem? Oh, got it. Okay, so that's what it is. And have you ever had any kind of GI bleed since you had GI surgery? Did they tell you not to take any NSAIDs or aspirins because it could easily cause a GI bleed?
Yeah.
Yeah, there you go. And that can definitely cause anemia too. You know, and you may not even know it. You know, that could cause blood loss. Yeah. Isn't that something, huh? Yeah, gastric surgery really puts you at risk for bleeding in the future if you use NSAIDs and aspirin, by the way, too. So, and you get the malabsorption problem. Wow. How about calcium?
calcium, I take supplements, but all my levels came back normal
Oh,
except for
good.
my H&H.
Yeah. How about protein? You have to eat a high protein diet too because you have gas. Yeah, high protein. Yeah. High protein, calcium, iron. What about B12?
My B12 is actually high. So
Oh.
my RDW is also high.